they want to.
And welcome to Let Them Talk. I'm Paul DeRienzo.
And I'm Miss Joan Moossy.
And our guest is Dr. Sharon Stancliff of the Harm Reduction Coalition. She's the medical director, and we're going to be talking about how you folks out there who partake in things that maybe you shouldn't but do anyway can keep from getting in a lot of trouble. So welcome to the show, Dr. Stancliff. Sharon.
Thank you. I'm very glad to be here.
Yes.
Yeah, thanks for coming.
And we're looking forward. I heard your speech at the harm reduction part of the marijuana rally on May 5th. I was fascinated by what you had to say, and I thought that it was such an important message that you should be given an opportunity to give that same message that you gave there to the viewers here on Manhattan Neighborhood Networks and let them talk. And
I think we should start with what harm reduction is, because I think a lot of people don't understand what that means.
Well, that we're talking about heroin and other hard drugs, and a different way of approaching that problem, if you even use the term problem anymore, even though it's a problem for those people who get arrested and who get sick because of it, of course. What is harm reduction, and why is it so important, and what's the harm reduction movement doing today?
Well, harm reduction is a different approach to the problem of drug use, which sometimes is a problem, perhaps sometimes it isn't. But in harm reduction, we realize that many people in this world do use drugs, and as much as people try to talk about a drug-free America, we don't think we're going to get there at this point. So many people are using drugs. Harm is done by drugs, but a great deal of harm is done by lack of knowledge about drugs, lack of skills to take care of people while they're using drugs, and lack of treatment for that matter. And so it's a very pragmatic approach, and it's not unlike the rest of the way I practice medicine. I don't cure diabetes, I prevent harm that diabetes can do. So in harm reduction, we approach the drug user as an equal partner in the care that's going on and help to provide the tools and knowledge people need. One of the sort of key points of harm reduction, of course, is syringe exchange, in which we prevent people from having to use a dirty syringe when they're injecting. Excuse me. This has been an incredibly successful policy in New York City. Back in 1990, about 50% of injection drug users in New York City had HIV. In the year 2000, it is down to under 15%. And during that time, needle exchange became legal in 1992. And not only did people start handing out syringes, people gave drug users the information that they needed to use clean syringes, and they picked up and went and found clean syringes themselves. So they actually did the work of harm reduction. We, as the providers, just began to help provide the tools and the education.
I have a question about needle exchange, because I saw on your website that there's some prison systems that have needle exchange, and it said in 7 countries there's needle exchange in prisons. And I'd never heard of that, and I wondered, it's not in the United States, is it?
No, there is no access to syringes whatsoever in prisons in the United States. There's just really a blind eye to the fact that people do get drugs and syringes in prison. Just a couple of years ago, somebody died on death row of a heroin overdose with a needle. So if you can get them into death row, you can get them anywhere. Several countries are really looking at this, and several countries are doing it at this point. I'm not the international expert I wish I was today, but I can tell you that Iran is doing this. Iran has more syringe exchange access than some of the United States does at this point. I believe that Italy is looking at this. I know that Australia has looked at this, and I'm sorry I can't list off the countries that are doing it. But several countries are. There is injection in prison, and of course there's sex in prison. In the United States, there's very little condom access in the prison system as well, if any.
Well, by the way, our number, we're live here in the studios, and our number is right there on the screen, 212-757-1538. We'll take your questions about harm reduction and about ways of preventing or overcoming the problems of an overdose. So the thing that you were talking about on May 5th that fascinated me was how folks can respond if a friend of theirs goes into an overdose. If someone takes too much heroin and they began overdosing, there's actually now a program you were talking about to get out there and to help people intervene and to possibly save their friend's life in those type of circumstances. Can you tell us a little bit about that and even lay it out to folks who might be listening and might not admit they have a problem but could really use this information?
Sure. First, I just want to start with, where did this come from? In New York State, since April 1st of 2006, it has been completely legal for a non-medical person to possess and use a medication called Narcan, which I'll show you how it works in a few minutes. But Narcan will completely reverse the effects of a heroin or other opioid overdose. And I imagine this bill was sponsored by the legislature because they recognize overdose as a major public health problem. On the average, there's 1 or 2 people dying each day in New York City of an opioid overdose, usually heroin, but across the country we're seeing a huge increase in overdoses because of prescribed analgesics such as OxyContin or Vicodin, because people are misusing them intentionally, or unfortunately sometimes doctors don't know how to prescribe them properly. So this is a huge public health problem, not just for those of us that care about heroin users, but in New York City. In New York City, there's more overdoses than there are homicides or suicides each year. So it's a significant public problem.
Right. And behind us on the screen, we have a symbol. It's called S.K.O.O.P. Get the S.K.O.O.P. What's that about?
Well, the S.K.O.O.P. is the project of the Harm Reduction Coalition, which started up a little before the law changed, actually, because we recognize this as a serious problem. And it stands for Skills and Knowledge on Opioid Overdose Prevention. And so what we have been doing, and I'd like to go through it step by step, but we've been training drug users, their friends, their loved ones, and the social service providers that work with them in New York City on how to prevent, how to recognize, and how to act on an overdose.
Okay. And what do folks do? How do you recognize,
Right, that
what's the usual drug-taking scenario? It could be any type of situation, but let's say, do folks, like in the movies, like in the French Connection, they go to CD dives where they pay $2 so they can go in a back room of an abandoned building and shoot up? Is that how things happen nowadays, or have things changed from?
Things have changed a little bit. In New York City, there used to be a lot of places called shooting galleries where people did exactly that. Now it seems to happen in smaller settings where maybe one person has an apartment where some people hang around and shoot drugs. Many people, unfortunately, will take drugs by themselves for various reasons. There are certain parks around the city where you'll find a number of drug users, and in fact, one of those parks knows where everybody keeps the naloxone, the Narcan, to reverse the overdoses. But it's a little less organized in some ways than that.
So is the first step that you advise against doing it alone?
Many people will do it alone, but we suggest that if people are using drugs alone, they are extra careful. That if they're going to mix drugs together, well, let me step back and say there's 2 main scenarios people are likely to die in. One, if they mix classes of drugs, so they mix heroin with whiskey. Then perhaps they're a methadone patient and take a lot of Xanax or other benzodiazepines on top of it. And in fact, even though cocaine's a go-faster drug and heroin's a go-slower drug, about 40% of the overdoses in New York City involve heroin plus cocaine. So if people are going to mix drugs, they're advised to be very careful if they're going to be alone. And then the other big, really big risk factor is when people have been away from heroin or opiates for a while and they relapse to use or choose to use again, they've lost their tolerance and a little bit goes much further. So we actually see a tremendous death rate when people come out of prison, come out of detoxification center, and other kinds of drug treatment programs. That's a really risky time. I know I can't convince people to stop relapsing, stop mixing drugs, or stop using alone, but if people can avoid doing those things at the same time, and if you have a friend that just came out of prison or just came out of detoxification, don't leave them alone if you think they might relapse. If they disappear behind the bathroom door, be alert if they're not coming out. If a friend of yours is using...
tell them. And just the information itself is so important.
Absolutely.
To disseminate the information.
Well, how do we know when folks are sitting around and they're doing drugs, how can they tell if one of their friends is not just passed out, but this is a serious situation?
And that's a really important question because overdoses are so often witnessed by people that don't know what's going on and are not certain what to do. Most people are at the highest risk of overdose if they inject their drugs rather than sniff them or other ways of taking them in. And it's actually a slow process. It's not like in the movies people inject, they fall over, they're dead. Most cases, people inject, they nod off, their friends may think that they're just really high, whereas in fact, slowly the respiratory drive is shutting down and they stop breathing. And so what people need to do is be aware of somebody that's using around them. If they're really in a deep nod, maybe just sort of, hey, are you okay?
That could be enough right there.
Well, that could be enough just to find out what's going on. That way, if they say, oh, leave me alone, they're okay.
Well, how about like a cold cup of coffee or a glass of water in the face, or shaking somebody.
Well, first you just want to find out if they are just really high, because you don't
Okay.
want to be somebody nobody wants to be around.
Right,
That's kind of the
that's a
story.
bring down.
But if they don't want water and salt.
Enough.
Are you okay? Right.
Put a bucket of water on it. Oh my God.
So the first thing to do is kind of check in a little bit. If if your friend doesn't say something, you shake a little bit harder.
Mm-hmm.
And if at that point they're not responding, then you get concerned.
Mm-hmm.
And drug users do a variety of things, and they talk about putting ice on the genitals or in the armpits, and that's good stimulation. But since I hear about people running down to the deli to get ice, what you have with you all the time is your hand. Rubbing the knuckles up and down on the sternum. Everybody try this at home. You rub hard, it hurts.
Oh,
and
real
if
hard.
somebody can sleep through that, then they're going into a coma, essentially.
I see.
So that's when we
that's an
recommend they start
interesting
acting.
test.
Yeah. And squeezing fingernails, but this one's just real easy. And
Okay, so it's actually hard. So like, it's impossible for anybody to sleep through that.
exactly, you'll see police officers doing this on the street. You'll see ambulance drivers. It's the medical thing.
Right.
I've never heard that.
Really? Well, it's a
Right.
good tool right
Okay,
there.
show it,
Yeah.
do it to me. Ow!
Yeah.
All right, that's hard. Okay,
Yeah,
let's
it's-
see
So
if it
you're not
works.
overdosing.
Okay, thank God. All right, that's interesting. Okay, so
Okay, so next they
next
find
step,
out the
person
person
is
doesn't
non-responsive.
respond.
Yeah.
They're non-responsive. We'll come to the Narcan in a minute, but this is not a replacement for calling 911. We instruct everybody the first thing they should do is call 911 looking for an ambulance. Now, drug users in New York City and many places know that police are very likely to come, and so there's a great deal of fear of calling 911. And they have a variety of things. There's a mythology out there that's rather dangerous. Drug users often believe that if they fill up a syringe with salt water and inject it, that will bring somebody back. The stimulation of poking the needle in is sort of like rubbing the sternum, so it appears to work sometimes, but that's dangerous in that it's a waste of time. People
Well, that's
will,
sort of urban myth. that's
Exactly.
out
It
there.
doesn't dilute anything.
no, a little tiny bit of salt water is not going to do anything except possibly waste time. People sometimes inject cocaine. That would seem to make sense, but we've seen already that cocaine is associated with overdoses. So we try to get people to stay away from the myths. They're really sold on them sometimes, so it's just like, this works better.
How about a Pulp Fiction movie where they inject something like adrenaline directly into the person's heart? Was that
Oh,
for
dear.
dramatic, or did they really do that?
That was for drama.
Yeah,
The
okay.
Narcan that I'll show you in a minute is injected in the arm or the leg, and in fact about
In the muscle.
In the muscle. And about the only way you could do harm is injecting in the chest, because you
Don't
might
do
pop
that.
the lung. No,
Okay.
everybody's
So
doing
in
Pulp
the
Fiction.
muscle means that you don't have to find a vein.
Right. If you hit a vein, it works faster, but there's no time to find a vein, and if somebody is really overdosing, it's really hard to find a vein. Their blood pressure's down.
Now, what is this little kit that you have?
Okay. Well, I don't want to leave behind 911, so they do
Okay,
call
so
911.
Right.
And
before
one
anything
last
happens.
thing I wanted to
Go
say
ahead.
about that is when police come in New York, sometimes there'll be an arrest, but I've been reassured that for the most part, although there is no law against it as there is in New Mexico, police do not often arrest at the site of an overdose. Now, that doesn't mean you shouldn't put the drugs away, don't leave them on the table where it really forces the issue, but it doesn't happen often in New York City, the police arrest.
Once it's in your system, it's not like some states that say, well, you're possessing because it's in your blood.
Actually, that's illegal in this country. The Supreme Court came down with a decision on that some years ago.
that's
Right
good to
now,
hear.
it's a little under
Something-
question for pregnant women, but for everybody else, they have the right to have it inside them.
That's the
Yeah,
law. I'll never understand the law.
right.
So now, can people get this?
Right. People can get this. Now, this is Narcan. It's a medicine that will completely reverse the effects of an overdose. It is legal for a person to carry it and to use it, even if they're not a medical person, as long as they in good faith believe that somebody is having an overdose. The difficulty is that it remains a prescription medicine. Now, it's a very low-level prescription medicine, like Motrin 800 is a prescription medicine, so it's not a controlled substance. But one does need to see a medical provider in order to obtain the kit. Now, what we do with the Harm Reduction Coalition and an increasing number of places across the state is we go out on the streets into needle exchange programs. We train people there. It takes about 10 minutes to train somebody, and then we actually give them the kit after a very, very brief medical history. And so it doesn't take very long, but it does require having a medical provider there. And at the end, I'll tell you the website where you can find the places that are doing it. And it's not just needle exchanges anymore. Columbia University is doing it. The drug treatment program is doing it. The Department of Homeless Services is setting up to do it. And we even hope that Rikers Island might begin to find a way to provide it to people that have been in prison there.
And where do they keep these kits so people can have access to them?
Where did the people that get the kits keep them?
Yes.
Well, we try to keep it small enough that people can actually keep it in their backpack, possibly even keep it in their pocket. Some people keep them at home. When I find that there's a place where maybe a lot of people come to use drugs, I try to make sure there's a few kits there.
It seems really important for people's families, too, that are concerned about a drug addict relative, because a lot of people live at home. And if they come home and their mom finds them and doesn't know what to do, it seems like an incredibly important thing to have in the home.
It's a very new program, and we would really like to begin to reach out to the families of the heroin users so they can obtain them. And then, in fact, at this point in this country, more people are dying of prescribed opiates than they are of heroin. And so we need to begin to reach the folks that are misusing the opiates. Perhaps this should be in every medicine cabinet like Ipecac used to be, at least anywhere that anybody's prescribed opioids, because they themselves might make a mistake, might misuse them, or somebody might leave with them from their cabinet. So it's so simple, it should be common knowledge.
So we've come to a situation, by the way, Dr. Sharon Stancliff is medical director of the Harm Reduction Coalition. I'm Paul DeRienzo with Miss Joan Marie Moossy, and you're watching Let Them Talk. We are live, and our phone number is on the screen, 212-757-1538. And we're discussing getting the scoop, ways in which you can, if you are a heroin user or you know a heroin user and love a heroin user, you can maybe save their lives. And this is a kit that we're discussing that is legal to possess, and which folks in the Harm Reduction Coalition will help you, and other groups around the city will help you learn how to use
And acquire.
So that you will have an emergency first aid in case someone you know and someone you love goes into a coma and might be dying of a heroin overdose. You can save their life, possibly with this treatment. And we're going to actually show the treatment, although we won't go so far as to actually use my arm to inject it, because I feel needles.
Here.
Greatly, and it's kept me protected against heroin and other such needle drugs. I fear needles, as many others. So let's look at it.
Yeah,
Okay, so this is the kit, and it comes with a set of instructions in Spanish and English, in case you forget what you learned in the training.
Okay,
Can I
and
hand
we're
these
going to hold
things
this up
up?
a little closer to the camera so folks can take a look at it. This is what to look for. Get the
brochure.
scoop, the brochure. And the
It teaches you how
brochure,
to do it.
right, has the step-by-step process, and we have here.
So it basically reviews what you teach people
Exactly.
All right,
in person when
show
they're
this a
given
little
the
bit.
kit.
And you can see it's pretty short. There's not a whole lot to it.
Not complex.
Call 911, do mouth-to-mouth breathing, and inject Narcan.
All right, so we're going to talk about that right now.
So then the other little item we offer is a mask in case somebody wants to do mouth-to-mouth and the person's mouth doesn't look so savory. So they've got that on hand.
I never saw that before.
Yeah, they're cute little things.
And this is from mouth to mouth. This is like the Boy Scouts.
Yeah.
Maybe everyone should
And
have
I'm going to
that.
put this on my
Yeah.
mouth just so.
Go ahead, it's yours now. So, and that will protect somewhat against tuberculosis, herpes, and is just a little more sanitary.
Yeah, I see that. That's amazing.
Yeah.
So you breathe, there's like a permeable membrane
it,
here, and the rest
Exactly.
of it is plastic. Okay,
Yeah.
great.
Now, we actually have a pair of gloves in here if somebody has the presence of mind to put those on. That's per the health department. And there should be an alcohol swab in here. Now, I don't insist that people put on the gloves and the alcohol swab. It's very scary when you're looking at somebody you think is going to die. So when it comes with 2 syringes and 2 doses, actually we're about to increase it probably to 3 or 4 doses of the Narcan. This is a very small dose.
Right.
When people are woken up, if anybody's ever seen somebody woken up by EMS on the street, the emergency medical
I'm going to
services.
zoom in on you just so we can see it a
Okay.
little better while you're doing this. So we're going to try.
Okay.
Get your hands.
We're going to try and get your hands in there. There we go. Great.
Okay.
Good, okay.
Okay, we're going to shoot at your hands here, and
All
A little
right.
back. It's
Okay.
going out of focus
I'll
there.
fix it.
Okay.
Great. Okay, so I'm taking out my needle. I'm taking the cap off of the Narcan here. And I'll just let that drop on the floor. Now I've got a pretty big needle here. Oop, there we go. I've got a pretty big needle here, and even a very seasoned heroin user is going to go, oh my God, that's a big needle. So now I stick it into the little vial,
Down a little
Oops, sorry.
bit. Good.
and I just draw in the
Move
liquid.
your hand around maybe just so we
Yeah.
can see that. Can the needle hold that so you can just take your hand off for a second?
Okay.
and we can just see the
there you go.
bottle,
That's
right?
it,
Yeah. So I'm drawing it up, and I want to get most of that fluid in there, but if I get most of it in there, I'll be fine.
Okay, I can take whatever.
Yeah. Now I've got a little air bubble that I'm squeezing out. Little air doesn't matter if we inject, so now I'm ready to inject. Anybody want? Now it's a very safe medicine, actually. If I were to inject anybody here, as far as I know, nobody's on pain medicine or methadone or heroin. They would say ouch because it's a big needle, but it would do no harm. If somebody was in insulin shock, it would do no harm. If somebody had a heart attack, it would do no harm unless you delayed calling 911. Now notice we even have kind of a cute little needle here, so I'm flipping a little cap over here. So I'm not going to prick myself when I get rid of it.
I see.
So-
And how do you get rid of it after this is done?
Well, in New York State, it's legal to get rid of needles and syringes 3 ways. You can take it to a needle exchange. You can take it to every hospital and nursing home has to accept household sharps. And finally, if you put it in a sharp-proof container, duct tape around it, label it household sharps, you can throw it in the trash.
Oh, I see.
But in this case, if somebody discards it inappropriately, it's not going to harm anyone. When
Anybody.
most needle sticks happen in hospitals and people put a cap back on. So this way I just flipped it around and I'm not going to hurt myself.
I see.
So now I've injected you,
Right.
and if it's a heroin overdose, in about 2 to 5 minutes, you're going to wake up. And if you're dependent on heroin or methadone, you're not going to wake up happy because you're actually going to be in drug withdrawal.
Oh, I see.
On the emergency medical services, actually give a much larger dose, so people sometimes wake up really unhappy, bad words, sometimes
It's like
vomiting.
instantly going into cold turkey.
Exactly. Now, if there's somebody that just relapsed, they'll just wake up and feel normal, and I've seen
Oh,
that.
I see.
But if they
They
will go
haven't
in.
had a
Now, is
re-addiction
this just
experience.
heroin,
Exactly.
or will it work on any other kind of an overdose?
It will work on any opioid. So opioids include heroin, methadone, OxyContin, morphine, opium, Dilaudid. It will not do a thing for a cocaine overdose, and that's something we need to instruct people about, that if somebody's having a seizure or just kind of bugging out, this won't do anything for them. Now, a lot of opiate overdoses happen when people mix with other drugs, especially downers like alcohol or benzodiazepines. So what you're going to get then, you're going to get this person breathing again, you're going to have somebody alive, but they will still be high on the other substance,
I
so
see.
they may be even less fun.
And they still need medical care at that point.
Ideally, 911 should be called, and we've seen in our studies that about 75% of the time it is called. But in fact, most people will survive even if they don't go to the hospital.
So, naloxone, that's this drug. When you put it in your body, basically, let's go back over the shooting. You basically take your arm or some fat part of their, could be their leg, any
Yeah.
place, and you just like put it right in, straight in.
You put it straight in, just poke it in like a
Straight in,
dart.
And then you push the plunger until it's all the way in. Now, if this person's passed out, are they going to like wake up screaming as soon as that hits them, as soon as they get a needle in them?
2 to 5 minutes. I mean, now if they weren't really overdosing, they may say ouch when the needle goes
I
in.
see, yeah.
I did wake somebody up once by saying, we've got the Narcan, because it's a very unpleasant
brought 'em
experience.
Right, right.
But they
Oh,
won't
I
wake
see.
up for a couple minutes.
I
The
see.
emergency medical services sometimes actually restrain people, but this is a more gentle dose, so that's why there's extra doses in the
I
kit
see.
if it's not big
But
And
enough.
so
Tell
you
us how
should
some
see a
folks are-
response within 2 minutes. Should you see an immediate response? Like
2 to 5 minutes, really.
their eyes will open and they'll say, "Where am I?" Basically.
Right, what happened, what'd you do to me? And
Okay.
if they don't get a response in 2 to 5 minutes, if they haven't called 911, they better do so, and they can give a second dose as well.
I see.
So,
And it really just, when it gets into your system, it just neutralizes the heroin.
well, it's
the
kind of,
opiate.
it's sort of like if you got out of heroin fitting into all these little keyholes in your brain and opening them.
Yeah.
What Narcan does is it knocks the heroin out of the way, and it fits into the keyhole, but it won't open the door. Just like, you stick the wrong key in a door
I
and you
see.
can't open it. And in about 30 to 90 minutes, the Narcan will actually degrade, and the heroin or the methadone or the OxyContin will start to act again. But in the vast majority of cases, that 30 to 90 minute window is enough to save a life, even if they don't go to the hospital. We've seen studies
Because they're
proving that.
using it, the heroin that's in their system is eventually getting used up.
Exactly. Plus, you've got them up and moving. You've changed the situation there. You're not going to let them nod off
I
again.
see.
Now, how do people get this? Because it seems so
Yeah.
important.
Well, now you can find a list of all of the sites that are offering it right now at health.state.ny.us. Follow the links to HIV and then to harm reduction there, and it will list all of the needle exchange sites that are offering it. You can call me at 212-213-6376, and either extension 39 for me or 38 for my associate Carolyn Rath. Those are two ways you can find it. All of the needle exchanges in New York City have it. As I say, Columbia University is beginning to offer it. And then finally our website, harmreduction.org, can help you find it.
And maybe repeat that phone number again for folks who give them a chance to get a pen.
Right, 212-213-6376, and it either extension 38 or 39. I'll be gone for 2 weeks, so you probably should try 38.
Okay, and that's harmreduction.org.
Exactly.
Where they can get links to find out more about getting the scoop,
Right.
that we just talked about.
And this kit.
At what point do you gave me this the for mouth to mouth? When do you think you need mouth to mouth? Should you use that?
When people aren't breathing. So you kind of want to check and see if somebody's breathing or you think they're not breathing. Then start with them a couple breaths, then give them the Narcan and continue breathing until you get help. We don't actually teach CPR on the street because that takes more than 10 minutes. We want to get this out as far as possible.
Now, this has been out now for a while. How many people do you think in New York City alone has this, getting the scoop, the use of Narcan in these kits, saved? How many lives is it?
Well, we've gotten reports of about 190 people reversed.
190 people.
Now, I can't guarantee that everybody would have died. Maybe only half of those people would have died. And in addition to that, we don't understand why, but we know that many users that use the Narcan kit don't come running back to tell us about the overdose.
Right.
Because when we go out and ask people, did you use their kit? They're like, oh yeah, I guess I should come and get another one. So we do know that it's underreported by as much as a quarter, maybe even a half. So we're hoping as the time goes by, we're going to see a dent in the statistics in New York City overdose.
Right. And how about in other parts of the United States, this kind of thing?
Yeah, I'm glad you brought that up. This is something that really needs to spread. Connecticut and New Mexico both have laws regarding this, and New Mexico even has a law that says you cannot be arrested if you call 911 for an overdose. But we really need to make this a national thing. Either other states need to pass laws allowing for this to be prescribed and carried, or better yet, a federal law saying that this is a life-saving method. And what we would ideally like to see is naloxone over the counter as it is in Italy. In Italy, you can go down to the drugstore and buy it, and there you got it.
Keep it in your house.
Exactly.
I saw something on your website in the news section. There was an article from Washington, D.C. in May, the end of May. It's a very recent article about the fact that Washington, D.C. doesn't have needle exchange.
Washington, D.C. did not have needle exchange until today.
Oh, really?
Today the law changed.
Oh,
So Washington, D.C. with a major HIV problem will now be able to have funds to fund the needle exchange that does exist,
Right, which
but
is
just
Mr.
barely
Daniels. Right, yeah.
Exactly. So
And
today's a great day.
That's great. We have less than a minute to go. It's interesting you mentioned Iran is one of the countries that uses needle exchange in prisons, and it's something that the United States doesn't do. That's fascinating. Is that because they have a traditional long history of dealing with heroin and opiates? They grow it there.
Well, they have a huge problem now, but really it was several doctors in Iran that privately just got this going, and then they worked really hard doing their form of social marketing, and it's been accepted on higher and higher levels. So they have really some unique programs there.
Maybe we can reach out to President Bush and whoever replaces him in 2 years to have that same kind of foresight.
Right.
Where harmreduction.org, Dr. Sharon Stancliff from the Harm Reduction Coalition, Medical Director, talking about, detective I should say, talking about how you can save someone's life by using these little kits.